This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to We All Belong, Voices of Lived Experiences. My name is Carol Merton, and our participants are sharing their stories to increase the awareness and understanding about the challenges of everyday living and survival. Some are unhoused or at risk of not having a roof over their heads. I thank those support agencies and services who work hard every day to meet people's needs and who have helped in the development of this program. And today, one of those services that are helping those who are most marginalized and at risk of being unhoused in our community are the SOS team, or Supportive Outreach Service. And I thank all of them for being here today. So, first of all, I'm going to introduce you to Heather. Heather is the nurse practitioner with the Supportive Outreach Service. And Heather, I'm wondering if you would mind introducing your colleagues. And then we've got some questions to go through, and I'm hoping they'll all pitch in and be able to speak to the questions and provide their input. We are taping live outside, and we're actually located just in the little bit of overhead that's behind the farmers market, downtown city of Owen Sound. And hopefully we'll be able to also go on a bit of a walkabout on the streets of Owen Sound as well. So thank you for joining us here, and thank all of you. Over to you.
My pleasure to introduce Sandra. She is our social navigator with United Way. Teresa is a paramedic with Grey County, and we have Mackenzie with CMHA, our mental health counselor.
Excellent. So a great group is joining us today. So I only went over these questions with the group like 3 minutes ago, so this is going to be absolutely fresh. The answers, they're going to wing it, is what they've said. So first of all, what was the reason that you got into this work? Why are you here helping those who are at risk and marginalized in our society? Over to you.
Thank you. Mine might be mundane, I suppose. I've been a nurse practitioner for about 15 years, and that entire duration's been spent supporting individuals who are unrostered to a primary care provider.
Okay.
So whether that was in chronic disease management or mental health and addictions, it's just always what I've done. And I had the unique opportunity to participate in the pilot project of SOS after the COVID outbreak in Hanover.
Okay.
And that's when I joined the team, and it's been a perfect fit, and with a perfect team. I would dream of leaving it.
Oh, excellent, excellent. So before I go to the others, what's different about this experience with SOS compared to what you were doing?
I really value the flexibility and what we can do. Really at the forefront is serving the client and their goals. There really isn't that policy and procedure and the mundaneness of being in the corporate environment.
It's okay to say that. It's quite okay.
So the flexibility is brilliant, and helping individuals reconnect with the health system is one of my roles, and that's amazing to see. So be able to help people feel safe, establish trust, and help them reintegrate to the services is always a privilege.
Sometimes, and it sounds to me as if what you're able to do is provide the direct care without a lot of the bureaucracy that can slow down the services that are required.
Absolutely.
I don't want to take the words out of your mouth, but I think
the systems have failed these marginalized folks, and we are being creative and curious and finding new ways to deliver care and sort of mend some of those fractures.
Excellent. So, anyone else want to pipe up why you got into the job? Because you're all from different perspectives, really.
My work as a PSW and my lived experience showed me how many gaps there are, how many people fall through those gaps, and ultimately how a little bit of hope goes a really long way.
Ah, excellent.
For me, I'd say it's because my own lived experiences and the way that I've dealt with my own things over the years. And someone once said to me, we're all one decision away from winding up in a similar situation to what our folks are that we help every day. So that's always stuck with me, and I just want to raise awareness for mental health and addictions and what it's really like for people living it every day.
Thank you.
I would say that I got into this field as a student who was very curious about this area of life and the aspect of addictions as well as mental health. And I think that my lived experience has kind of pushed me in this direction to be here and helping the people that need it the most. So yeah.
Thank you all. And having lived experiences, I'm assuming, you know what they say about people who assume, that it helps make it more real, and what you can offer comes from a place of understanding, a place of knowing, which I think is a value added from what I'm observing to the people that require your services. So I notice you call them clients, not patients. I've heard it said participants, but they are receiving your service. They're a client receiving your service.
That's right. So depending on our agency, we are a collaborative of 5 different agencies.
Yeah.
So you'll hear us call individuals, if not by name, one of those terms. But yeah, we don't own them. They certainly are voluntary. And yeah, they aren't patients.
Yeah. So what's the hardest part of what you do?
The hardest part for me is when the system fails. When we develop a plan, often, we work with up to 30 different partner agencies to try to support individuals.
Yeah.
Not all at the same time necessarily, but
Yeah.
even our group is 5.
Yeah.
So when we try to create a care plan with an individual and it falls through because of one of the very many fractures or gaps in the system, for me that's the hardest. When we've proven them right, that the system isn't meant for them.
Yeah.
That's really hard.
Because they come feeling let down.
Absolutely.
The clients feel let down. They're looking to you to help them.
That's right.
That must be so frustrating.
It can be. Yeah. And there is not. We can't house everyone. We can't shelter everyone at the tent. We don't have infinite funds.
Yeah.
And it's a Band-Aid approach isn't what we all want, right?
No.
It's a starting place, but to get someone to the end, it's really hard.
So you end up being creative and flexible about working around the system,
right.
and you don't have to say yes or no, but you just did.
I just did. Yeah, we work with the system in creative ways to help meet needs.
What I'm really hearing you say is clients first.
Absolutely.
Clients first.
Yep.
Yeah,
Yep.
because that's who you're caring
Ask
for.
for forgiveness later sometimes. Yeah.
Does anyone else want to comment about what the hardest part of their job is? Anything different to add?
I would agree with you on that.
Yeah. So the bureaucracy, the policies, procedures, the rules get in the way sometimes of client care.
Yeah.
And I think, we all have a role to play in trying to remove those barriers for sure in whatever way we can. So on a positive note, what's the most rewarding part of the work that you do?
Anyone else want to start?
I'd say probably just the getting to know so many new people every day, and the reward of seeing them succeed and knowing that they did the work.
I love that answer.
Yeah, that's great.
I would say
Do you want to share your mic?
Yeah. Pointing my front to you.
You're looking like you're pirouetting around.
I would say building relationships with folks that never trusted the medical system at all, and being a paramedic. Some circumstances they've been through in the past that have kind of broken their trust, and us being able to rebuild their trust in the healthcare system and the social system.
Yeah.
I like that.
Yeah.
Would agree. Yeah.
So that's a strong responsibility you carry, to not break trust. When people come to you then, they need to feel safe. So it wasn't a question, but I do throw a few in. How do you create that feeling of trust and safety so the clients will come to you and in some cases come back to you?
Almost always come back. Our statistics show that 75% of people return to us. And I don't think there's probably a lot of agencies that have that kind of success rate.
No.
We don't aim to fix things on the first visit. So going slow, understanding the pace the individual is ready to move toward, non-judgmental, and not trying to assume we know what's best for them, right?
Yes.
Everyone is their own individual and having their own experiences, and I think making a lot of space for them to direct and us to support. You know, we're not here to fix, right?
And
Yeah.
sometimes all it takes is one gesture that starts the process.
Yeah.
Whether in some days it's a pair of socks.
Every day it's a pair of socks.
Yeah,
Other days it might be, hey, I've heard your story. Thanks for sharing. And that's
Yeah.
enough.
yeah. So I've heard the phrase "no wrong door." How does that fit for the services that you provide through SOS?
Anyone else want to take that? No one do? Oh dear, okay. I think the market is a great example. Everyone's welcome. We really don't have criteria for folks interacting with us. We know who to communicate with within our other partner agencies to help point people in the right direction. We have a really flexible exit plan as well when people graduate or move to traditional services. We do what we can to help people get their needs met. Walking through the emerged doors is terrifying for a lot of individuals, despite what the hospital is doing to try to make it as welcoming as they can. They've got their own difficulties. I'm not sure.
I think just knowing that if we don't have the answer in the moment, we're gonna get it. We work with some very strong individuals in the community that if we have a question, we go to them and we get a response, we get a plan made.
Yeah.
That's sort of the no wrong door, because we'll find a new one.
Yeah.
Or make one.
We have a motto that is we don't ask if, we ask how. Did I say it right? Yeah. That we really don't take no for an answer really well.
Good to
As
know.
politely as
Really
possible.
good to know.
Yeah, as politely as possible.
Yeah.
We get it done.
When you mentioned about the market, and we don't have the van, but I know it's there because I saw it parked up the street, but you're here at the Owen Sound Farmers Market certain days where people can come, but you're also in different locations as well. Hanover, I think you mentioned, as well as a variety.
That's where the market idea started, was supporting individuals during the COVID outbreak in Hanover.
Yeah.
And then it was extended to Owen Sound, and it's been a great hit ever since. We have clinics in both those cities regularly, but we're also in Meaford, we're in Durham, we are Dundalk, Chatsworth. We visit the motels as needed. That's what we have available for emergency shelter right now. And we're at Safe and Sound at least once a week. Yeah, we've got a fixed clinic there, and that's sort of our hub. Yeah.
So in your traveling clinic, which is your machine, your van,
Yeah.
what do you have in there? What are, besides socks, what else would you provide care for on any particular day?
So we actually have 2 vehicles that you'll see around, and very soon you'll see a badged vehicle because ours are a logoed vehicle. So we'll have the SOS logo on the side of the United Way's big white van.
Excellent.
But in there sometimes we have water, we may have hats, sunscreen, shampoo.
Yeah.
Sometimes I have tents, but
Yeah.
it really depends on
Yeah.
the week, what's been ordered,
Yeah.
how many have already gone out.
So what happens if someone has an open wound?
Yes, as they do, yeah. Especially this time of year, a lot of our folks who are living rough, bug bites tend to be a very primary site of infection.
Yeah.
So we treat a lot of infections currently. We keep a very well-stocked EMS bag. It's sort of what we modeled it after. So
Okay.
we travel typically in an ambulance or a EMS truck,
Yeah.
which has obviously emergency management products.
Yeah.
But we also, we treat wounds, we treat withdrawal.
Yes.
And we can start someone immediately on opioid agonist therapy, different types of medications if they want to stop using substances or use substances more safely.
So you as a nurse practitioner are able to prescribe that?
Absolutely.
And
Yeah.
that's an important role.
It is.
So I have a question.
Yeah.
Well, I have a few.
Yeah.
But what if they need a prescription? Let's say antibiotics or whatever,
Yeah.
and they have no funding to pay for the pills.
Right.
What
so
happens?
we've got a number of options. So we do some of us work out of the Grey County building and have very close connections to our social services department.
Okay.
So with consent, we can help people get OW very quickly, in which case they receive benefits for medications.
So that's Ontario Works.
That is Ontario Works, sorry.
Yeah, that's okay.
Same for if someone has OW or ODSP,
Yeah.
or private benefits, or OHIP Plus if they're under 25, sorry.
Okay.
That's covered for
Yeah.
it. But we do carry up to 30 medications with us,
Yeah.
knowing that a lot of our individuals have strained relationships with pharmacies locally, don't have identification for controlled substances, etc. So
yeah.
you can't, without a health card, generally receive medications under those benefits.
Right.
So we do carry it with us, and that is covered by our partners.
Yeah. And that's the system barriers to care that you mentioned
Yeah.
earlier. One of them for sure is, but I'm sure that.
Yeah, identification is always a challenge.
Yeah. The age groups that you have, what would you say? Like, what are your age span? What's the youngest you would have seen, and what's the oldest you would have seen?
We typically serve adults and seniors, but that doesn't mean we haven't worked with youth. Mackenzie certainly has much more experience working with children and youth in mental health. We have worked with pregnant persons and been able to assess children in the care of our individuals. We don't seek out children, but
No,
they
no.
tend to arrive. We try to send them to the other more appropriate agencies when that does occur.
So by seeing pregnant women, you're actually treating too.
Absolutely, yeah. So, and the pregnant person who is using substances or receiving opiate agonist therapy requires specialized care.
Yeah.
So we do try to engage our partners, but are often the bridge to help people access traditional services like obstetrics.
Yes, lots of information sharing.
Yeah.
Yeah.
With consent.
Yeah, always. Yeah, always. Yeah, I know, I understand. So I know the producer has given me the high sign, but I have some more questions. If you don't mind spending a bit more time with me.
Yes, of course.
Perfect.
No, we're done.
Oh, harsh.
My Uncle Cheney was one of over 150,000 Indigenous children that were taken to residential schools between the 1800s and 1996. My uncle ran away from school wanting to get home to his mom and dad, and sadly he didn't make it and died of exposure. When Gord Downey found out about my late Uncle Cheney's story, he wrote Secret Path, a series of poems that became an album, then a graphic novel, a documentary, and a concert. Gord met my family, and together we formed the Gord Downey and Cheney Winjack Fund. Together we are sharing Secret Path and other reconciliation resources with legacy schools, setting up legacy spaces across Canada, and hosting events like Secret Path Week to inspire all Canadians to engage in reconciliation. Before he left us, Gord asked us all to do something.
You're gonna figure it out.
Will you join us? Together we can make Canada a better place.
What kind of show do you want to see on Rogers TV? What interests you? Log on to rogerstv.com, fill out a show proposal, and tell us about your segment idea. We want to know what you want to see. Rogers TV, only on Rogers.
So, a lot of what you've been saying, I sense a need for change to really increase the resources and the ability to care for the clients who are marginalized. How do you see your roles as advocates for change? I mean, you deal with individuals face to face, but you see the larger picture. What do you do to try and bridge those gaps as well? Big gaps, chasms.
I think it probably starts with the no, or how else can we look at, not that that is a big part of it. At every opportunity, we're kind of pushing the boundaries on what we can do safely to meet the need.
Yeah.
We do things like this. We present at national conferences. This is a really unique team, and people are curious about the work that we're doing and the successes we've had. We're trying to work hard with, the new wellness center opening is hopeful. 14th Street opening is really hopeful. We're hopeful of a shelter. We're hopeful of a safe consumption site. We're hopeful of 24-hour accessible washrooms, right? There's all these things that we are...
Yes!
So there's a lot of places where we, put our toe in the door and really want to have a say. Do you have anything to add?
I'd say we as a social navigator with the United Way, we all, like, our background, our backing, I should say, is the Poverty Task Force, Jill Umbach, Francesca. They all do their best to take all the policies to whatever next steps need to happen in order for us to create that change. But a lot of those suggestions come from where we start here, and then we just move it up the ladder.
Yeah. How about you? Anything to add? Who are you?
Just as the paramedic on the team, I have a different group of people that I can speak to. So I've been really fortunate to be able to do some education for our paramedic staff, which has been really beneficial because it's not really something you learn a lot about in paramedic school. Addictions, mental health, it's not really focused on. So to be able to share with our team that are interacting with these individuals all the time, what addiction really looks like and how it actually changes a person's brain. So some really neat educational opportunities is what I've been excited about.
Yeah, excellent. How about you? Anything additional?
I would say our approach, coming from a harm reduction perspective, is really the essential part of making that big change. Moving from the perspective that sobriety is best, or that there's a certain pathway to take to get to a place where these people can be housed or working. That is not necessarily our approach, and that giving them the space to make small changes towards bigger changes, I would say is part of our process, and that's what kind of makes us those advocates for change at the same time, mostly with our clients and not with other services.
And I think as the information spreads, more people become aware. I know one of the segments, so I'm going to put a plug in for one of the segments. I know that I'm planning on doing a segment with Annette Pedler from Safe and Sound, the executive director, and we've actually got 10 or 11 commonly asked questions, the myths about these vulnerable populations. And one of the questions has to do with, well, why are you giving them harm reduction supplies? Is that not encouraging them to continue to use? But by protecting them from additional infections and other illnesses, am I right in saying it actually helps?
Yeah, that's absolutely one of them. Yeah, so hepatitis C is probably one of the most significant chronic diseases that we help manage and monitor, and certainly that is one of the biggest reasons why for people who are using injection-based drugs. That is helpful. Additionally, when people are using by inhalation, we don't know what residue is in the pipe, so we don't want people sharing.
Right.
So making sure someone can have their own and know what's in it is certainly much safer than sharing.
Yeah.
Again, another source of transmission of infections is by mouth as well.
So whether they're addicted or whether they have other health issues, their safety and well-being is just as important as anyone else's.
That's right. And harm reduction isn't just giving out those types of supplies. It's supplying a helmet. It's a walker. It's safe footwear.
Yeah.
There's lots of ways you can view harm reduction, right? I mean, I think the community has certainly accepted helmets, right? We need to view it the same way.
Good point. Yeah. So it's all part of a larger picture, right?
It is. Yeah.
So, what changes have you seen among the people that you have worked with over the past year? And I know the producer will wave at me when it's time, so I'm just going to keep going. Well, there you go.
And then there were 3.
Yeah.
Did you want to answer that?
So
changes
the
in the
changes in the patient, or have there been any?
Absolutely, there've been many. Seeing clients go from example using every day to reducing their use due to their medications, getting to a place where they can start work, getting to a place where they can get their kids back, where they can start visiting again, getting to a place where they no longer seek anymore, where they're actually focused on other parts of their well-being, and that plays a much, much smaller role the further along you get.
Yeah.
And then I would say, additionally, our SOS mobile group is sort of just one tiny part of the bigger SOS with our 30 partners. And our primary goal was to reduce opiate deaths. So we're really proud to say that nobody within our roster of individuals providing care to, nobody's died. So overdoses do happen, opiate poisonings do happen, but people are better prepared. They have Narcan, they know how to respond, they know when to call 911, and they're less afraid.
They're less likely to use alone.
Less likely to use alone, and that was a huge issue during the pandemic, obviously.
Yeah. So that's, sorry?
I think the education is a big piece of it too. Like being able to educate clients in terms of what the future could look like. And getting out the information around, their safe use and things like that brings them back, and then they trust the source of the information, so then they're more willing to ask questions about bigger things.
So it takes time to build a relationship as well then. My favorite question.
You're getting it.
Yeah. If you had 3 wishes that would bring about change, or more than 3, what would they be?
You want to start us off? No, you're going to start us off. Okay, right. Start us off. Sorry.
3 changes.
Or 3 wishes. What would you wish for? We have 3 minutes. Got to talk fast.
I think we said earlier, housing for all is a big one. Reducing stigma so that people feel comfortable enough to come. Anybody else?
I would say community education, or just more of an understanding of the experiences of our people and the ways that they can probably contribute to make change to stigma or in other areas.
Anyone else have a wish if you could bring about change?
I think just what Mackenzie said there was just a great understanding for the general public. Again, about what addictions and mental health actually looks like, and know this is not a choice. It's not something somebody wakes up and decides this is the life they're going to live. It's not the way it happens. So I think if more people had an understanding of what actually goes on, they might have a little bit more empathy. I think that's my answer.
Back to you for the summary.
Summary, okay.
Do you have a wish?
In addition to what they said, I still think we need a shelter. I still think that we need a safe consumption site. We need more affordable housing. And the idea, housing for all, is important, or housing first philosophy. There are many people in our that we serve who are considered not housable. They don't have the skills. They aren't ready. But they deserve a place to rest their head safely at night.
That's a human right.
It is a human right. Yeah.
I want to thank all of you so much, and I want to thank our viewing audience as well for joining us today for the program We All Belong, Voices of Lived Experiences. Please join us again for more programs and more stories. Meanwhile, take care, stay safe. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Tuesdays on City TV.
We find missing people who have slipped through the cracks, and we bring them home.
We need to talk about how you figured out this location before us cops.
We all have our secrets. You kidnapped a child.
And you kidnapped a man.
I tell you what to help with, and you help with it. You can't manipulate me.
But I did. I'm your partner.
No partners. You're a monster.
Found. All new. Tuesdays, 10/9 Central on City TV. Or stream it on City TV Plus.
If you want to understand the decisions being made about your community, please join us on Rogers TV Cable 53 on Mondays at 5:30 p.m. or online at rogerstv.com.